A revolutionary new computer, which enables patients with long-term diseases to monitor their condition from the comfort of their home, is to be rolled out across Kent. A small pilot of 250 users in the county has been so successful, another 1,300 are to be installed in patients' homes. The telehealth system enables patients to monitor their blood pressure and weight daily, the information from which is fed back to a nurse or matron through their phone line.
Wait for about 20 seconds until the result appears on the screen.
The healthcare specialist can then see if the patient needs to see a doctor, or in some cases can detect a problem from early symptoms and deal with it without the need to go to hospital. In a global first, existing users of the system are being trained to help new patients with basic technical problems by Lisa Roberts, who's flown in from the States.
We have thousands of users in the States, and we are excited to be here today because this is the first time we've ever heard of this kind of an approach where you take experienced telehealth users themselves who want to actually have some knowledge and expertise to contribute and to actually have them be the frontline contact for some of the new users so that they can immediately access them through their cell phones and troubleshoot very basic things like batteries dying or cords coming unplugged, simple things, but at times they can interfere with the technology working. And sometimes you just need someone to remind you that something needs to be plugged in a certain way, and then it's ready to go. So it's a very innovative concept. We're excited to see how it works out, and as you can see from some of the folks in the room, they're very knowledgeable and very excited to be able to give back to something that has really improved their quality of life.
The pilot's been running in Kent for over a year and has seen an 80% reduction in the number of patients being admitted to hospital. Patients like Harris.
Prior to me being on the telehealth, I used to spend actually 8 to 10 months in hospital, and since I've been with telehealth, I've spent 3 nights in the last 17 months, which is a great benefit to me. And I know the system works, so it is, it is on my own interest to promote the services that I've received for somebody else to benefit. It's given me independence at home. If I'm unwell, if my blood pressure is high, it's monitored on a regular basis, so they can pick it up straight away. The community matron can get hold of the other consultant or my GP or hospital, and if they need to increase my medication or decrease it or change it altogether, it's done almost immediately, instead of me waiting for weeks and weeks and weeks waiting for the consultant to see me.
Leslie has chronic obstructive pulmonary disease and is another patient being equipped with a mobile phone to help new users.
It feels that we're doing a benefit for other people as well. It's like a close community, we can all help each other and just hope we can solve some problems for each other. It's also a comfort, it's something there, it's reassuring. And then also my husband is on telehealth through a heart attack and a stroke, and we can both help each other and we don't worry about each other so much.
This is the first time a group like this has been set up in the world?
This is the first. We haven't heard of anything else anywhere that is doing this sort of level of support. There are expert patient groups, of course, but they only run for small periods of time and are very focused. This is across the technology and the support and is unique to this particular programme.
More patients with long-term diseases will soon be able to receive a referral from their GP, empowering them to live life to the full.